Welcome back to Where's My Diagnosis? On this episode, we unpack the last 12 months, including a May 2024 scan, an emergency room visit, appointments with new doctors, and yet still no diagnosis.
So, Carrie, in May 24, that is 2024, you had a CT scan. What was with that?
Yeah, I had to pay for a CT scan myself. I was going to have another laparoscopy to just, I guess it acts as surveillance, and I was still having chronic and pretty critical symptoms, and with no evidence of disease, I found another expert. She was in Sydney, and she had ordered another CT scan with contrast for my my chest, my abdomen, and my pelvis. So I went and had that done in East Melbourne. And the report just showed a growing fibroid in my uterus and something at this stage, because I was in almost a year and a half now of surgical menopause, the fibroid should be shrinking. So this is the same fibroid that's been flagged for internal vascularity that I was somehow bumped out of the gynecology unit. And so 2024, all the report stated was I had a growing fibroid and there was no evidence of disease.
This is what the CT scan said.
Yes.
So have you got a copy of that scan?
It was online, and I luckily took lots and lots of screen recordings and screenshots of the scan while it was up, because then when I went to Cabrini this year, 2025, January, they were asking for if I had other scans. I said, look online, there's plenty. And it was taken down after that.
After that appointment?
After I was in emergency, and they looked at my scans and then sent me for a scan. When I got home to look at the scan online, I noticed that the scan that used to always be up, the 2024 CT scan, had been removed.
Right.
But the report remained.
So after the CT scan, you went to Sydney to have the surgery.
Yes.
But didn't the scan say there was, or the report say there was nothing wrong?
Well, it just said there was no evidence of disease, but with this disease, it's so tricky that it doesn't always show up on the scan, so there's always surveillance. So if you have symptoms, and symptoms as catastrophic as mine are, there's something going on. So the surgeon needs to have their eyes on it.
Yeah.
And there's a lot of bowel and everything to look through and places to hide. And yeah. So anyway, I had the surgery. And as I was waking up, the surgeon hands me these images of my organs that have disease everywhere. And I know it's disease everywhere because I've seen now 3 sets of images, and the disease progression is obvious. And when you put them up against it, and then you compare it to other diseases with like peritoneal carcinomatosis, which is when a cancer spreads to the abdomen and the pelvic cavity, it's exactly the same as mine. So, and because it's a macroscopic finding, meaning when the surgeon lays eyes on it, they can tell what the disease is. So I'm not a surgeon, but I've looked at hundreds and hundreds of images, and I've compared mine with other patients, and they're saying, yeah, it's the same thing. The implants that the disease disseminates throughout the cavity look like little clear fish eggs initially. And then the mucin, like, depends on the cancer aggressiveness, it just starts creating this goop, like I was saying. And that is now, like, it was just a little bit, 2 years ago when I had that pelvic surgery. There was what I know now to be mucin, so it's like yellow stuff coating everything. And then 3 months later, when I had the surgery in 2023, it's progressively worse and looks terrible. And I don't know what other than cancer could cause such drastic changes. But when that gynecologist cut through the peritoneal membrane and orange fluid poured all over my organs, that was cancerous ascites, and that's the color of it, and it was never reported. So remember, she gave me the USB, and I watched that thing, and I just watched it hundreds of times, and she never reported on so many things. So
yeah, so clearly no answers. Lots and lots of questions, however, coming from that. And then my understanding is from there you started to look offshore to get support. Tell us about that.
yeah, because I just felt that I was being boxed out of the system. Like this wasn't, there was something seriously wrong with me. And the more I pushed to find answers, the more rude and aggressive the surgeons and doctors became, and the more vague everything was. And then the more it was just focusing on, they're saying, you know, I'm a cancer phobe, it's my mental health, all of that. But I was getting progressively worse and worse. And they're handing me images that show visible disease, but telling me you're pristine. She used those words. The surgeon in Sydney said, you're pristine, and showed me these images. I'm like, what? No, I'm not. And this is, I'm just waking up from surgery. And she said, yes, you're pristine. And I went, this is anything but pristine. And then I told her about the other images. And then the other thing that she said to me, because she had already admitted that there was a bunch of mucin in my pelvic cavity, which there would only be if it had spread, right? And so she goes, yes, that's mucin, but it can easily be reabsorbed into the body. And this is absolutely false. It cannot. Not. This type of cancerous mucin is sticky and visceral. So it sticks organs together. It doesn't absorb. It's not a normal coating that you have that just gives you that slippery coating so organs can just kind of rub against each other and it's no big deal. It's not that.
Okay, so it sounds like that whole May 2024 experience, getting the scans, getting the surgery for surveillance, was no help at all in terms of it actually probably made it worse for you, because it looks to you like the images that you were handed from the surgery are clearly showing degeneration from the earlier pictures you've got, and yet the reports are saying nothing to see here, move on.
That's right. So it's just clear progressive disease everywhere, and the scans are showing the same thing. So like I said, I was teaching myself to read ultrasounds initially, and then, you know, the PET scan and the different like CTs and MRIs. But with the last CT scan I had, I compared that to the one I had a year previous. And so in the exact same axial image, so it just has a slice, there's just a certain slice that the machine is looking at. So I'm looking at that and comparing it to one a year previous, and there's more circles, like darker circles, lighter circles than there was on the year previous image. And then when I got the understanding of PET scans, that made me, it just was, because it glows, it was easier to highlight where the disease progression was. And then they have another part of the scan called the MIP, which everything's in black and white and your body's spinning like a 360-degree spin, and it shows all your organs and where the cancer is. I mean, always, the brain, kidneys, and bladder are always lit up because they're excretory organs, and the brain just always has a lot going on. But the other ones, showing the right-hand progression that they're saying is the left, was obvious the right side of my body because it's right underneath the liver. So this keeps spinning, and that shows me where the disease is. And you can even see, like I was talking about, the slow burn, how the cancer, if it was the breast cancer, it would start off as a slow burn. And in the metabolic activity in the PET scan showed that there was activity in the breasts, but as you got further down, it got darker and glowed more. So it was green and there was some red in there. And then the one when I was able to read the brain and the eye cap, like the orbital cavities and stuff, I went and had my eyes tested in 2020 and had Specsavers, and the optometrist found 2 lesions in my right eye behind the retina. And so I had that, like, again, no biopsies, no staining. They just said, it looks like this, don't worry about it. So I didn't. And then the PET scan on the orbital cavity is lighting up on the right-hand side. Hot. The hottest that any of my PET scans light up. And it's the lesions. Anything benign isn't going to light up.
So from there, you start to look to other places for a solution, specifically the US. Talk to us about how that came about, how you went down that path.
Well, I mean, my understanding at that point was still, okay, it's appendix cancer. It's a 1 in a million cancer, and you need an appendix cancer expert. We clearly don't have many here, and the ones that we do have are not finding disease, but they're showing me images of disease. So there's something going on. So I need to go outside of this country to find the truth.
So how did you get there?
My friends and the cancer group in America they organized a GoFundMe. And I just had a bunch of friends and different supports just pour money in, and it paid for my ticket over there and the surgery.
And how did that surgery go?
Terrible, just like all of these ones are going. So she did admit that my bladder was grossly distended. And then she said that, she goes, but we drained it after surgery to provide her relief. And then I just thought, well, why would you drain a bladder after surgery? Don't you need to have the visual to, not risk injury and to see disease? So that didn't make any sense. And I had just gone to the bathroom and I had fasted. So I wasn't able to drink from midnight. And I remember pushing on my bladder to make sure I could get everything because I wanted her to see everything possible. So that didn't make any sense. But she said, no evidence of the cancer. She ended up giving me a failure to thrive diagnosis.
What does that mean?
I don't know. Well, I'm not thriving. So, I mean, I guess it's probably the most accurate diagnosis I've been given. But why I've been given it, I don't know.
I mean,
I'm not a baby. I'm not an old lady.
It also kind of sounds a bit like you have to be no longer with us before you could get that, surely.
Well, and I just, I'd love to see anybody else thriving in these conditions.
Yeah, exactly.
Like, yeah, I'm failing to thrive, but I'm not getting enough oxygen. That would, be one of the reasons I'm failing to thrive.
Yeah. Part of it. Sure.
And then I also read in the report that she denied my appendix had perforated, which is absolutely false. Both reports she had with her, so the 2 times that my tumor was pathologized, again, I don't know if that's a word, it states the mucin was seen to have perforated in multiple sections. So where did she come up with it hadn't perforated? And then she goes on to state, it makes me look just ridiculous, and it does. She's had this surgery, no evidence of disease. Then she had this surgery, no evidence of disease. Then this one, and now mine, no evidence of disease. So it's just mental. So I was given this failure to thrive diagnosis.
Okay, so the US was a real big fail on all fronts, it seems. So now you come back to Australia. I presume you get back to Australia, okay? And then you get this out of the blue heart echo checkup from the Alfred.
Yeah, I come back to Australia to nothing, no help, and just progressively worse. And then the Alfred rings me up. It was a Friday. I was in the car. And they said, we've been trying to get a hold of you. You have a heart echo. I can't remember when it was. So let's just say December. And I just said, well, this is the first I've heard of it. And they said, well, we've been trying to text you and call you. And I said, well, this is the first time my phone's rung with your number. And they said, well, we had another number down here. And I said, and yet here you are ringing me on this number. And so she said, so 8 a.m., the Alfred, you have a heart echo. And I said, who ordered it? And she named the doctor, but I didn't recognize the name. And so I said, okay.
All right. So what was the results of that? Did you get the results?
No, because they said I had to give them the name of my GP. And then when I made the appointment to get the results of this heart echo, which I still do not have because the secretary of my GP of 10 years passed on a message not trusting of any of the medical profession, including my GP anymore, which I'm not. So she said it's been a therapeutic rupture and I'm to seek another GP. So I didn't get the results of that. And no GP really seems to want to take me on, and I don't really blame them.
Okay, so you've just been given the flick by your GP and you can't find out. But were you worried about your heart?
Yeah, it's doing wild things. And then there was when I was one of the hospitalizations, I mean, I never get past emergency, but it was at like 42 beats a minute. And then my blood pressure was, I think it was 70 on 50 or something like that. And then everybody came running in and they just said, oh, you're just not on the right. Just get on your other side and you'll be fine. Okay. So I just rolled to the other side. And
Which side was that? I might need to know.
Yeah. Go to your
episode.
Yeah. Go to your left. No, go to your right. Yeah. Okay. Roll to your right.
Good to know.
Yeah. Apparently.
So then it was after this that we started to go to doctor's appointments with you, because obviously we're hearing all these stories
to
and
see
we're
it
like,
for yourself.
what the actual fuck? Like,
maybe
it's just,
she is crazy.
It's so hard to wrap our head around because again, we're spending time with you, we're seeing it for ourselves that you're not
decline.
well.
Yeah,
exactly. And we've known you, again, as we've said earlier, for over 25 years.
Yes.
So we know you well. We can see it. Even I'm sure listeners can hear it in the shortness of your breath. And
I'm trying to hide it. Sorry.
No, you don't need to hide it. Just be comfortable. And so at this point we're like, is literally how we're feeling.
What?
There has to be a doctor out there that can solve this mystery or whatever the hell it is.
I wonder what it could be.
And then off we head to, we had 2 rounds of local GP, one GP that went, oh, actually I'm retiring, sorry, I can't help.
But did note, I'm going to be honest with you, your liver is a little bit elevated. And I looked, and one of them was double and a half what it should be. My, well, it doesn't matter. The ALT, I think, is the one that they look to for liver damage or cell damage. And that's the one that was double and a half higher than what it should be.
Yeah.
And then the other ones too. And then you put in my jaundice, the abdominal distension. Okay, something's going on with my liver. And then you look at the scans and there's holes in my liver.
Yeah. So give up on him. And
giving up on everybody. I've got a long trail blazing behind me.
We just decide, okay, the local GP on the corner by the roundabout, let's just go knock on the door, see if somebody in there is competent and cares.
And willing to give me a referral to palliative care. That's all I'm asking for at this point.
Because by that point in time, you'd kind of gone, I don't even need a diagnosis now. I just need to know I'm going to be comfortable as this continues to get worse and worse, and pain management.
Yes, but I need a diagnosis to get the pain management, and I need a diagnosis to get palliative care.
Exactly.
Yeah.
So off we head to the local clinic. And we meet a doctor. Do you want to tell the rest of this particular story?
Well, I presented as I was, and I wasn't particularly well, as you said. And I had all my bloods with me, and it was the elevated LFTs. The calcium was elevated as well, I think, at that point. And a couple other things, my cholesterol and something else. And albumin, maybe? And then she went to examine me, and she weighed me, and I was quite heavy at that point, the heaviest I'd been. And I was 38 kilos at Christmas time, which I thought, okay, I've got my foot in the grave. It can't be long now. And then I started noticing that everything started thickening up. I was like, I've never had a butt in my life. I've got a bit of a J-Lo booty happening. How? I'm 48 kilos and it's only been like 3 weeks. How did I gain 10 kilos?
And you've hardly moved, hardly eaten.
Oh no, I was eating. That was
stage,
at that point. I was still eating, and I had a pretty hearty appetite. It was almost like, I don't know if the cancer, as it progresses, it makes you hungry. Like if cells are dividing. I would wake up at 2 a.m. sweating, like I was saying, with granola bars, like muesli bars beside me, because I just munch on one or two, have my water, have more muesli bars. I'm like, okay, I don't feel sick anymore, and then I could go back to sleep.
So you're 48. You're 48 kilos, despite all of that.
Yeah, 40. I got up to 48, but it was more the abdominal distension. It was really killing my lower back, and it had blown up quite a bit, and it was just really smushy and just weird. And she freaked out about that. Then she said, "Let me look in your mouth." And then remember, she looked in my mouth. She went, "Oh," and she was actually mad. And she's like, "Why are you not under anyone's care?" I was like, I've been trying. It's not through lack of trying. They've shut me out. And she didn't believe.
Yeah. I mean, I think the thing that really stood out in my mind was how important it was for you to actually hear a medical professional go, "Oh my God, this is serious." And she was, as you say, really irritated and annoyed that you didn't have that care around. I would actually say also perplexed by that. She couldn't understand why that was the case.
Couldn't get her head around it.
And really alarmed in terms of the state that you were in and what we needed to do next.
Yes. And so she said she will write me I said, I just need a referral to palliative care. And she said, you could die tonight. You need to go to hospital tonight. I will write you a letter. And I was just like, it's not going to do anything, because I'd had that many hospital episodes where treated seriously with the ambulance, dismissed at the hospital. That was the running. Like, I knew that was going to happen again. So I went, I'll survive the night. And so I went home. You went, "Are you sure?" I'm like, yeah. And I did. That was months ago. So I got through the night, and then you and Kev arrived the next morning, and took me to the hospital.
So yeah, we present to emergency. We didn't have to wait too long, which was nice.
No, the nurses took it super serious. They got me in straight away. They did my bloods. They said, "Oh my God, like, what painkillers are you on?" I went, "None." They went, "Oh, we'll get you whatever you need." I said, "Well, it's fentanyl that's my body responded the best to. Like, I didn't get sick, all that. Like, I'm really sensitive to opioids." But then again, once again, nurses are always lovely. Doctors are different. And then I got a bed in this room where I was hooked up, and then they weren't reporting on the findings, the physical findings. So when that ER doctor was palpating my abdomen, and it was full of something, it wasn't gas, it was squishy. And then I said, "Well," and he goes, "Yeah, it's full." And that's all he said, right?
His whole approach right from
everybody's
get-go was, remember, this is the first time we've been in the room with you in that kind of scenario. But what I observed was his approach was just off from the start. And as someone who has gone obviously on a really long journey now, trying to understand what's going on with your own body, he kind of came bouncing into the room like,
all chipper and we'll get this sorted.
Yeah, and you're going to be fine. And ultimately ended up being really quite condescending and, really not listening and not understanding the patient in front of him.
Refusing to look at any of my bloods, refusing to look at the scans, refusing to look at reports. It was evident that
he didn't want to dive into your story. I mean, from our perspective, we were sitting there thinking, well, he's the emergency room doctor anyway. He's not the real guy we need. We just need this guy to make sure you don't die today.
And we never got that guy.
No.
Called things benign when he didn't test for it. Didn't report on the ascites that's clearly distending my abdomen. Didn't report on my coloring. Just said it was a suntan. Then I was sent to have an ultrasound done of my abdomen. And I left you guys in that room and I went to get a scan done. And the doctor did the scan and said that everything's clear and was very reassuring, seemed honest, but they always do. And then I was discharged.
Did he mention anything about that your ascites wouldn't necessarily show up?
He said that gelatinous. I said, well, then what's in my abdomen? Because there's clearly something, I'm at that point, was I 48? Yeah, 48, 47 kilos. And I should not have this big jelly belly. And he didn't have an answer to it. He just said that sometimes gelatinous ascites doesn't show up on an ultrasound. So I said, well, why am I having an ultrasound? And he said, well, you might need a CT scan with contrast. I said, well, let's do that. And they never did that.
So overall, the emergency experience, again, turned out like the other experiences that you've had.
Yeah, I mean, that was just one example you guys saw. I have about 10 to 12 others, although Cabrini, well, I was refused a referral to an oncologist, but what we did get was a referral to a general physician, so like a Dr. House type guy. So Kevin and I went to that appointment a few days later, and he was all excited and saying that he's like Dr. House and he starts from the head and works his way down. I'm thinking, great, okay, let's get started. And then he brings up the scan and says, he brings up the report, sorry. And he said, it's all clear. I went, no, it's not. And then I showed him that it wasn't clear. And then he said, I can't help you. You need an oncologist. And then I said, well, that's what we were at the hospital for, but they refused us. And so once again, and he just said, I won't charge you. And and Kevin had to intervene and said, look, she's clearly not well. Look at her coloring, blah, blah, blah. And then he just did this kind of just not even really an exam. Like he barely touched my abdomen. He didn't want to see it. He didn't want me on the table, but I had to say, shouldn't I be on the table? And he just didn't want a part of me. They just want to get me out of their office is what happens. I won't charge you. Don't want to waste your time. Like what surgeon do you know or specialist doesn't want to charge anybody?
And the thing that is just endlessly frustrating is that once you walk out of that office, you're no longer their problem and you go back to being no one's problem.
That's right.
So I just want to take a few moments to give you an insight to Carrie's symptoms so you can really appreciate what she's dealing with every day while these doctors tell her that there's nothing wrong with her and not giving her the next step. So where to now? But this is what she's dealing with on a daily basis and what these doctors keep ignoring. So bowel dysfunction, issues with her bladder, which includes having no sensation of the need to urinate, loss of control and pain, extreme pelvic pain, upper and lower back pain, jaundice, oral thrush, small nodules in all sorts of weird and wonderful places, eye discharge, breast discharge, breast pain, groin pain, shortness of breath, or lung function score, chest pain. And that one, honestly, it's like that someone's just knocked the wind out of her. She has to grab her chest and just stop walking. When we're together, it just comes upon her. Dizziness, balance is off generally. The night sweats that you've been hearing about, muscle atrophy, abdominal distension. What's this one called, Carrie? Ascites?
Yeah, ascites. That's what blows my abdomen out.
Yeah.
Yeah, fluid. So cancer just creates fluid in the body and it just gets bigger and bigger.
Yeah. elevated LFT scores, which is a liver function test, elevated calcium, a lump in her leg that we're all just getting to watch grow in front of our very eyes.
Yep.
It's scary. Lesions in her eyes, super fuzzy brain, her words, not mine.
Yeah. And even EEG shows, even the brain wave data shows that it's frozen or whatever. That's their words, but
freeze response.
Yeah.
Yeah. The weight loss you've been hearing about, high CPR.
Yep. 160.
CRP, sorry.
Yeah. Well, that's what is an indicator of like a bad infection would give you 167, but you'd also have high fever and all the symptoms of an infection, which I never had. But I had a CRP score of 167. And like I said, under 5 is and it should be just, I think, 0.
Yeah. Right. Okay. POT is critically low.
Oh, very low. I think it was like 34.
What's POT?
The PO2 is,
PO2,
yeah,
sorry.
it's an arterial oxygen level, and that's consistent with hypoxia or lung metastases. And my oxygen saturation is 85%. That's below normal. And then my low TLCO. So when I had that lung function test, that's what indicates compromised gas transfer capacity.
Yeah.
And it's common in like tumor burden lungs. Yeah.
Those are the symptoms we could recall.
Yeah, I'm sure there's more.
Right.
Bad headache, my neck is killing me, stuff like that.
Yeah.
Yeah.
So again, just wanted to leave everyone with a very clear picture of what this
picture of health,
what this battle is about. It's getting answers to why are things continuing to just not add up? Why is nobody actually helping Carrie to solve this issue and get that diagnosis?
Mm-hmm.
Thank you for listening. So join us next time when Carrie will share how the medical system has continued to shift the narrative towards mental health while her scans, her symptoms and her functioning all point to advanced disease.